Hello everyone, welcome back. Today I'll be covering osteosarcoma, a part 2 video. In this video, started off with summary of types of osteosarcoma, evaluation of osteosarcoma patient by history and physical examination. Number 2, patient profiling. The role of blood investigation include full blood count, renal profile, liver function test, the role of albumin, ALP, and LDH. Number 3, diagnostic imaging of the primary tumor site, the findings during imaging, type of periosteal reaction in osteosarcoma, the role of MRI, CT, and nuclear imaging. I hope it helps. Now let's get started. Now let's revise regarding types of osteosarcoma. This figure shows classification of the types of osteosarcoma. It can be divided into primary, secondary, soft tissue, that means extraskeletal, and metastatic. For primary, can be divided into conventional, epithelioid, low-grade central, small cell, fibrohistiocytic, telangiectatic, multicentric, that can be synchronous or metachronous, intracortical, surface juxtacortical, that involve parosteal, periosteal, dedifferentiated parosteal, and high-grade surface. For secondary, osteosarcoma is due to malignant bone transformation of benign condition, example, Paget's, post-radiation sarcoma, or fibrous dysplasia. For soft tissue, extraskeletal, and metastatic, commonest is from the lungs and can affect the bone. Okay, everyone. Regarding evaluation of osteosarcoma patient, number 1, apart from clinical history and physical examination. Number 2, we do blood investigation for patient profiling to see the patient health status. For full blood count, we see the low hemoglobin shows the severity and chronicity of the disease. Total white cell count, especially the differential count, throughout other infective causes that can mimic tumor. Renal profile, to check the renal status of patient prior to starting any drugs, especially the chemotherapy drugs. Liver function test, especially the albumin level, for the healing status prior to surgery. In patient profiling, laboratory analysis of lactate dehydrogenase LDH and alkaline phosphatase ALP are assessed in the initial workup because they provide evidence for diagnosis and prognosis. ALP levels will be high due to the increased osteoblastic associated with osteosarcoma. Extremely high level shows a heavy tumor burden and is considered a poor prognostic indicator. It is important to evaluate the levels of the biomarkers later in the treatment process as well, as the level may decrease with success therapy or rise with residual disease or recurrence. ALP is very important. Number 3, diagnostic imaging of primary tumor site. A. Although MRI is the gold standard for diagnostic imaging of osteosarcoma, radiographs are generally the first study obtained when a potential bone mass is identified on the physical examination. A conventional radiograph of osteosarcoma may demonstrate medullary and cortical bone destruction, permeative or moth-eaten cortex, sunburst configuration due to aggressive periostitis, Kotzmann triangle due to elevation of the periosteum away from the bone, ill-defined fluffy or cloud-like osseous lesion, soft tissue mass, calcification of osteomatrix produced by the tumor. Now we will see a lot of radiological features. The first X-ray will show the presence of Kotzmann's triangle due to periosteal elevation. This X-ray shows patchy densities in the medullary portion of the femur, such as osteosarcoma. The next X-ray shows a distal femur X-ray. There is a osteoblastic lesion with sunburst appearance, and there is a osteolytic lesion with cortical thinning seen. Another X-ray shows a left tibia X-ray, especially at the knee joint. There is a sclerotic variant in the proximal tibia to show a conventional osteosarcoma. This next X-ray shows a lytic variant that shows a fibroblastic osteosarcoma. That means it can be osteosclerotic and osteolytic in nature. Another X-ray. On the left, it shows a low-grade osteosarcoma. On the right-hand side, it shows a high-grade surface osteosarcoma. There is a solitary bone lesion that may mimic fibrous dysplasia or desmoplastic fibroma. On the right-hand side shows a high-grade osteosarcoma that develops on the surface of the bone from the outer cortex. The appearance similar to periosteal osteosarcoma, but usually with more ossification. Kotzmann's triangle or malignant periosteal reaction may be present. Now regarding types of periosteal reaction in osteosarcoma. Number 1, sunburst or perpendicular type of periosteal reaction. This X-ray shows the sunburst appearance on the left radius ulna and also at the distal femur. There is also a Kotzmann's triangle as illustrated by the arrow. The second type is the onion skin or lamellated type of periosteal response. This X-ray shows onion skin or lamellated periosteal response. Lastly, combination of lamellated and sunburst periosteal reaction. This X-ray shows the combination periosteal reaction. As you can see, the arrow shows the lamellated periosteal reaction and the circle shows the sunburst periosteal reaction. B. Magnetic resonance imaging (MRI). After identifying a suspicious lesion on a radiograph, MRI may be necessary for further characterization. MRI able to define the extent of a tumor inside and outside the bone, the entirely involved bone, as well as one joint above and one joint below the tumor should be included in the study so that skip lesions are not missed. MRI can accurately and precisely delineate the degree of tumor in the adjacent soft tissues, the joint involvement, whether the tumor crosses the physis, and proximity to the nearest neurovascular bundle. C. For computed tomography. The role of CT is to assist with the biopsy planning and disease staging. CT may not significantly contribute to direct assessment of the tumor after radiography and MRI unless the osseous lesion in question is predominantly lytic. In the cases of lytic lesions, small amounts of mineralized material may be unobservable on both plain film and MRI. CT chest is the modality of choice for the evaluation of metastasis. Number 4, imaging. The nuclear imaging consists of positron emission tomography PET scan. It detects a highly metabolic lesions. It is useful in determining tumor extent and searching for subtle lesions after identifying a suspicious mass on initial diagnostic imaging. Later in the treatment process, PET scan is used for detection of recurrence. B. Radionuclide bone scan. Technetium-99 methyl phosphonate TC99-MDP is for detecting bone metastasis. Number 5. Follow-up MRI or CT scan, both with contrast, at the sites of metastasis identified on PET or bone scan. 6. Fertility consultation may be a consideration whereby chemotherapy and radiation therapy may affect fertility. Number 7. Biopsy of the lesion. So I have previously covered this topic. Feel free to go to biopsy topic. Yay, we have reached to the end of this video. See you in the part 3 video. Take care and bye.